Synchrony Health is proud to announce the arrival of Dr. Peter Geldner and Dr. Lawrence Eiteld of the Geldner Center, widely recognized for their expertise in plastic surgery and who have significant experience helping overweight patients after weight loss. We recently had a chance to sit and talk with Drs. Geldner and Eiteld, who helped answer many questions overweight patients might have.
My educational background kind of goes back to college at Johns Hopkins, medical school at the University of Wisconsin, general surgery residency at the University of Chicago. I followed the then chief of plastic surgery from the University of Chicago to Detroit, and then subsequently I finished with him in Galveston, Texas. So I've been around a bit, and it gave me some very interesting experiences, because in each of the places that I found myself, it was at a very intense and an exceedingly busy center. In Detroit, as you might expect, there was a lot of gunplay, a lot of injuries that are sustained in all manner of events, whether it's cancer reconstruction, to drive-by shootings, to some of the travesties that people do to each other. So you learn to kind of think on your feet. You really learn to expand and think outside the box. When I was down in Texas, we took care of a very large number of the indigent patients in the state of Texas, as well as all of the prisoners from the Texas Department of Corrections, which is a really interesting group, but it exposed me to so many different situations. And again, the principle of it is thinking outside the box, learning how to take the tools that you're given and the tools that you learn from the books and from your professors and put it together into unique ways to come up with solutions. I think that's probably the most important thing that you can cook up with, and that's just dealing with either bariatric patients or really anybody else. When I came to Chicago in 1990, I was on the faculty of the University of Illinois, and I remained on the faculty as an assistant clinical professor. Over the years, initially it was with a lot of work at Michael Reese Hospital, until that institution, as heralded as it was, has met its demise. I subsequently became a clinical instructor with the University of Chicago, and very often have the residents come to see how I handle situations, how I handle particular problems. So my experience in terms of different types of patients and different situations is really broad. I've seen the worst of the worst, and I've seen marvelously frivolous little operations, and you kind of put everything together into that which you bring to your patients. My view of the patient is a more holistic one. I take a look at that patient not as a bill of sale, not as just an operation, but as the person coming for this particular need. And I think that the most important thing that I can do is come up with a unique solution to fit that particular patient's needs. Well, every patient is a little bit different. It is not about a tummy tuck or liposuction or a thigh lift or a body lift or a brachioplasty arm lift. It's really about combining situations that fit the particular patient. So it's not just a bunch of little things that we put together just to make it sound good, but it's actually looking at that patient and trying to figure out what are the specific concerns that the patient brings to the table. What's their number one issue? What's the thing that they want more than anything else? And if you can reach the patient's desires, make an accurate assessment of the patient's anatomy, and even more importantly, delve into their physiology, make sure that they can tolerate this kind of an operation. Make sure that they're not going to have a major problem because they are in a starved state. So you have to be careful about all the details, but when you combine that with an accurate assessment of the patient and some creativity, you can come up with wonderful things. I brought Dr. Eiteld on with me in large part because he's a wonderfully skilled surgeon, but more importantly because he understands me and I understand him. So we know what we're thinking in most of these cases, and in many situations he can finish my sentences. I've worked with a lot of patients who have undergone lap band procedures. I've worked with a lot of patients who have undergone some of the gastric bypass procedures, even some of the really bad ones. So I think that there's a certain understanding from the overall medical standpoint, what are the patient's particular needs and how can we best serve them.
I was born and raised in New Jersey. migrated out to the Midwest where I did my training in plastic surgery, and then went to Texas for a short period of time to do some additional specialty training, and now I'm practicing here in both cosmetic and reconstructive plastic surgery.
What kinds of questions do your patients usually have for you?
The biggest concern that people have after significant weight loss is getting their skin to fit their body again. When people undergo significant weight loss, the fat will disappear faster than the skin can tighten, and therefore it's not uncommon to be left with excess skin that can hang and drape in unattractive ways. And so people want to know, how do I get my skin to fit my body just like the new clothing that I bought fits my body better?
Will these procedures leave any major scars?
There are scars with any body contouring operation. Specifically with massive weight loss patients, the excess skin has to be removed and the remaining skin redraped. That will leave incisions and scars, just like seams in clothing. The trick, though, is to strategically place those scars so that they can be hidden in as many types of clothing as possible.
Including beachwear?
Some types, yes.
Not thongs?
Probably not your thong, but something with a little bit thicker waist belt, you should be okay.
Does insurance ever pay for these procedures?
Typically not. Most insurance policies are written to exclude these operations, and they are viewed as cosmetic.
What if the skin folds are causing rashes or infections?
In select cases, they may make exemptions, but for most patients, in most cases, it's not covered.
Do patients need to be hospitalized?
Nowadays, we can typically do these operations very safely on an outpatient basis. The procedures are performed at accredited surgical centers, and people can go home the same day. The big challenge in the past had been pain control, but with newer techniques, we're able to provide better pain control in such a way that people can recover in the comfort of their own home.
How soon after surgery can patients return to work?
It depends on what we do and what you do. I usually tell people to plan on taking off at least 2 weeks after surgery before returning to work. Now that changes somewhat. If your job requirements are less physical and you're having less surgery, you may be able to go back in as early as a week. On the other hand, if we have much more extensive procedures and you are a physical laborer, you may not be able to go back to work for 4 to 6 weeks. But typically, most people can go back to work in a shorter time frame than that.
How long after weight loss should patients wait before seeing you?
The most important thing is that we know that the patient is at a stable weight. With any weight loss, especially surgical weight loss, there are plateaus that are reached. And so somebody will drop weight, level off, drop weight again, level off, drop weight again. And so we want to make sure that the person is at or near their stable weight before we do any of the contouring operations. Otherwise, if you're just at a plateau, then we may wind up in the same position again down the road. So typically, we'd like to see somebody for a few months at their final and stable weight before we operate.
Thank you very much for your time. We look forward to seeing you soon in Oak Brook.
Thank you.